My name is Renee Ori, and I'm the CEO and president of the Ori Maharaj Family Foundation, a nonprofit organization that addresses global public health issues. And I'm also a spatial data analyst for public health. And I would like to introduce you to one of my colleagues who also is a data analyst, Adebowale Daniel Adebayo. And so, can you tell us a little about yourself?
Thanks for having me here. My name is Adebowale Daniel. I'm from Nigeria, Nigeria. I'm a graduate of Federal University of Technology, Akure. I'm a data analyst as well in Nigeria.
Okay, so the purpose of us getting together today is to discuss public health issues that are not being addressed and to raise awareness about public health issues that are not being addressed. So currently, all over the world, including in Nigeria, everyone is mostly concerned with dealing with the COVID-19 pandemic and addressing the COVID-19 pandemic. Unfortunately, there are public health issues that are currently not being addressed all over the world. People are told to stay at home, and basically, it's like a standstill where whatever public health issues that they may have, it's currently being pushed under the carpet. So, for example, there are people who have cancer that are not being treated for chemo. There are people who have medications for diabetes and for hypertension and for heart disease, and all those people, their medications are not being filled. Their health is not being taken care of. They're told to stay at home. Now, this is the problem. The problem is you can't tell someone, tell your cancer, don't develop any longer. Stay still and just don't do anything so that I could deal with the COVID-19 at the current point in time. Unfortunately, cancers don't work that way. Diseases don't work that way. As much as we would like for it to stand still while we address one issue, we should be addressing everything from a holistic point of view, a holistic healthcare system response, where we handle both the external issue with the COVID-19 as well as the underlying public health issues that are currently not being addressed. Because while we're only addressing the COVID-19 and the public health issues, they are going to rise. All the problems are going to rise. People who have cancer are already immunocompromised. And the fact that they're not getting treatment, it means that they are more likely to contract COVID-19 than somebody who isn't. So if those people are treated while people with COVID-19 are treated, we would have less people in general at risk for contracting COVID-19.
Yes, exactly.
Also, in Nigeria and all over the World Health Organization established a community health worker program. And I'm sure you guys have something like that where you have community health workers. They go about different areas in Nigeria and they address different issues. You have somebody who gives out medication. You have someone who actually addresses diabetes or who helps deliver babies. And so this is my point, is that if it is that we have high density areas from a data analytical standpoint, you understand that there are hotspots that are going on in each country right now. And if it is that we could quadrant off the hotspots area and have the community health workers segregated per quadrant, then we could have a quality control method for handling the public health illnesses as well as the COVID-19. So you would have one person per quadrant. That way, one person from this quadrant will not interact with another quadrant, and it gives a quality control to the hotspots areas as well as other areas that are not hotspots areas. And that person, they would address the public health issues and the medications that they would need and see to all the needs per their area. So from understanding how that works, what are your points of views? Do you think that that idea could actually work?
Yeah. Okay. Can I come in now? Yes. Of course. That idea is very, very. I think it's the best way to approach the situation on ground right now, because here in Nigeria, before the case of COVID-19, we have a Lassa fever, which is the Lassa fever in Nigeria. It's like the most it's the endemic disease that we have in Nigeria. It was killing in some part of Nigeria, especially the southwestern parts. So the focus was on Lassa fever for like throughout last year. But all of a sudden that we have COVID-19 now, the attention has been drifted away from Lassa fever, malaria, meningitis, and other illness. But like where you said it now, I think it's going to work if they can actually find a way to segregate the workforce, to divide it and try to partition it. Like, yes, we know that we have COVID-19 now and we have enough resources to tackle it. We have enough workers or probably health workers to tackle it. But you just need to consider other illness. Like I still read it, like I think last week, that there are some cases of Lassa fever in Ondo State, in Nigeria, where we have the hotspot. So if nobody is ready to talk about that one now, meaning that people that have Lassa fever will just be rendered helpless. So I feel your idea of talking about probably having a quadrant and try to divide the health workforce to still maintain their approach for other illness, I think is the best. It's the best in this kind of situation that we are right now.
Yes, and the main idea is a holistic healthcare system response. So, apart from this, it's not as if I'm suggesting to neglect COVID 19 response at all. And a lot of community health worker programs are volunteers. We have so many medical students that could volunteer that are currently at stay at home right now. We have um, community leaders that
Yeah,
each community has a community leader that they're the ones that could actually get this um, going. And overall, in general, people who already have established public health illnesses, I think that the government should open up the pharmacies such that people who have a prescription from since the start of the COVID 19 virus, for example, like in certain areas it was in February, they wouldn't have to renew the prescription. They would immediately be able to use that same one at the pharmacies to get the necessary medications that they need. So that way you're addressing people who are already on medication and ensuring that they're getting the at least some sort of medical attention rather than leaving it and doing nothing about it.
yeah,
So I want to thank you very much for coming and meeting me today and for giving me your input. And I really appreciate you helping to let the public know about what is actually going on and what is being done and what could be done. Now these are just ideas, and I believe that with enough manpower and brilliance that the world has, we could improve on these ideas. So I would just like to thank you very much, and you have a pleasant good day.
yeah. Thank you very much. I really appreciate you for having me here. Thank you.
Okay. Good day.